Class 2 MOD preparation, situation tooth. In this exercise, situation tooth number 19 with underlying caries is used. Place a 330 burr on high speed. Size of the cutting burr can help one achieve ideal preparation depth of 1.5 to 2 millimeters. Shape of the cutting burr can help one achieve ideal preparation convergence, 5 to 7 degrees. Start with the ideal Class 1 preparation. Place the burr parallel to the long axis of the crown. Start preparing a Class 1 by removing caries from distal to mesial. Incorporate slight extensions into secondary grooves. Widen the preparation while maintaining the convergence of the buccal and lingual walls. Isthmus width must be wide enough to accept number 1 condenser, 1 to 1.2 millimeters. Pulpal floor depth, 1.5 to 2 millimeters. Evaluate retention form. Check buccal and lingual walls for convergence. Divergent mesial and distal walls, 5 to 7 degrees. Remaining marginal ridge width, 1.5 millimeters. Smooth and flowing outline. No sharp angles. No unsupported enamel at cavo surface margins. Note the presence of caries on the pulpal floor. Use buccal and lingual extensive proximal contact as guides for buccal and lingual dimension of proximal box. Place a barrier to protect the adjacent tooth. Ideal Class 2 preparation is achieved. Proximal boxes have convergent buccal and lingual walls. Break gingival contact, 0.5 millimeters. Axial wall outline needs to be convex, parallel to the external proximal surface. Rounded axial pulpal line angle. Axial wall depth, 1.5 to 1.7 millimeters. Note the presence of caries on the pulpal floor and gingival floor of the distal proximal box. Number 4 round burr on a slow handpiece is used to remove caries. Start removing caries from the DEJ, buccal and lingual walls, first, and then gradually move to the pulpal floor for further caries removal. A spoon excavator can also be used to remove caries. Number 4 round burr is used to remove further caries in the distal proximal box. Inspect all line angles for any leftover caries. At this point, the DEJ, line angles, and most of the pulpal floor are caries-free. Note that the mesial portion of the pulpal floor contains the deepest amount of caries. A ceramic burr will be used to remove the remaining caries close to the pulp. Inspect the tooth for any leftover caries. At this step, the tooth is ready to be temporarily restored. Arrange appropriate armamentarium and restorative materials. Calcium hydroxide, Dycal, will be used as a pulp capping liner. Equal amounts of both the catalyst and base will be placed on a mixing pad. A spatula is used to mix the two components of Dycal. Clean your instrument immediately after mixing. A Dycal instrument is used to transfer Dycal from the mixing pad to the deepest part of the pulpal floor. Dycal should be confined to the dentin and not placed close to the DEJ. Vitrebond Plus is used as a base to cover the Dycal liner. Equal amounts of the catalyst and base are dispensed. A spatula is used to mix the two components of Vitrebond thoroughly. A Dycal instrument is used to transfer Vitrebond from the mixing pad to the deepest part of the pulpal floor, where Dycal was initially placed. The liner is cured for 20 seconds. The Vitrebond should be confined to the dentin and not cover the DEJ. In this exercise, the automatrix system is used. Automate 3 tightening device is used to tighten the matrix around the tooth. Dental wedges are placed to create a tight seal and prevent overhangs. The gingival margins are checked for a tight seal. The band should be burnished and contoured to impart the desired proximal contours to the restoration. GC Fuji 2LC, a glass ionomer, will be used in this exercise. Transfer a drop of cavity cleaning agent conditioner into the well. Use a microbrush to apply this agent in the cavity preparation. After 10 seconds, rinse and gently dry the preparation. Do not desiccate. A Fuji capsule is shaken and is activated by pushing the plunger, green structure, until it is flushed with the main body. The capsule is set into a mixer for 10 seconds. Retrieve the metal plunger by pressing the top button of the GC capsule applier. Place the capsule into the applier by matching the groove on the capsule onto the applier's metal holder. Place the first increment into the preparation. Use a damp cotton pellet to condense the first increment. Light cure for 20 seconds. Add the second increment of glass ionomer. Use a damp cloth pellet to condense the second increment. Use an Explorer composite instrument to shape the embrasures and marginal ridges. Light cure for 20 seconds. The dental wedges and automatrix band are removed. Light cure the inner proximals for 20 seconds each. Check the anatomy and use a carbide finishing burr, superfine diamond burr, silicone points, and polishing strip to correct and polish the restoration. Check for proximal contacts. Seal the restoration of GC Fuji coat varnish. Floss the inner proximal contacts to remove any excess varnish before curing. Light cure for 10 seconds.